There is a conservative case for a universal single payer healthcare system. I'm Bernie Bro, and I'm here to explain all of that to you. As you know, any of you know me, one of my big pet issues over the years was the whole notion of the United States being a normal Western democracy that still has a free enterprise system, but also utilize common sense when governing and administrating a free enterprise system. And to me, certain things are a non-brainer. Medical care available to every single American, regardless of their income or status in life. Healthcare as a birthright from the day you die, the day you're born to the day you die, should be. It should not be a debate. It should just. It would be kind of like that's the duh position, not. Oh, that's crazy. But I guess progress has been made because um, when I first discovered the whole notion of countries abroad that provides free medical care available to 100% of the population, it made sense to me. It was not, this is a crazy idea. But when I discussed it with people, they're like, well that's crazy. Oh, that's crazy. Healthcare for everybody? Free? Government provided? That's crazy. We don't need to do that. Or it doesn't work. It doesn't work. It doesn't work. Oh, people are dying. People are waiting. People are suffering. I'm not going to say that there are shortfalls in those countries, but any shortfall that exists in those countries pale in comparison to the massive shortfalls of a failed market approach to healthcare. I am a socialist or a social democrat. Take your pick. I'm comfortable with either term. The reason I say I'm comfortable with either term because it is it is the ideology that is the most popular in most Western societies. It's the term that's probably used more than any other term around the world. Social democracy or socialist to refer to oneself. And again, these countries that have better results with their economy than we do here. In America, it's been the case all these years that the Republican Party pretty much are dead set against any kind of healthcare reform. The Democrats know it's the right thing to do, but they're scared they're going to become socialists. So they pussy around on how to have such reforms. Um, in the early 1990s, when Bill Clinton got elected and he declared appointed Hillary Clinton as head of the National Healthcare Task Force, she came with a convoluted plan that kept the insurance companies in there. Um, and frankly, as much as I don't like Republicans, I am glad that they were able to convince a handful of Democrats to vote that shit down. Because that was just not needed. In 2010, I actually wish that the Affordable Care Act didn't take place because, as far as I'm concerned, the Affordable Care Act, keeping the market approach to healthcare, um, would delay any attempts toward single payer Medicare for all. And of course, as usual, I'm correct. That's exactly what happened. Uh, I knew that this healthcare plan would work because where it came from. The Heritage Foundation came up with the idea in the early 90s, late 80s, as an alternative to what they feared a single payer movement was going to be, and it was used as an alternative to prevent single payer because they wanted to prop up the insurance companies if they ever pass, and then They know the American people will distrust any other governmental action, so a single payer system will not take place. You're stuck with an insurance based system, and no further reforms is going to take place, and the insurance company is going to become more powerful. And it was actually a very brilliant strategy on their part, as much as I disagree with them, because they were for it. They were for the Affordable Care Act before they were against it. Um, they were for it when Bill Clinton was president, and they were trying to make it as an alternative to Hillary Care at the time. And I think that Barack Obama wanted to be a person that could cooperate with both Democrats and Republicans. That's the problem with too many Democrats. They want to be bipartisan, and bipartisan usually means the Republicans have a bad idea and the Democrats jump on board and embrace it, which I think is bullshit. So, what happened? Obama presented the Affordable Care Act, and it was already in existence, a prototype model referred to as Romney Care in Massachusetts. And he figured, Republican governor, okay, I can take a Republican plan and get the Democrats and Republicans to sing Kumbaya, and we can come up with a health care plan, blah, blah, blah. Well, you got to realize what partisan creatures the Republicans are. They're uh, not the next door neighbor Republican, but elected Republicans in general are vicious partisan creatures. And so this was an opportunity to take a healthcare plan they were for and then turn against it and claim that it was communism on the march. We're going to become North Korea. We're going to become the former Soviet Union. We're going to become China. We're going to become Venezuela, which is stupid to say we're going to become North Korea because North Korea does not have universal health care of any sorts. And capitalist South Korea provides single payer health care to all their citizens. Um, Venezuela does not have universal health care. They have public clinics and they do things like that, but it's not a universal system. Uh, well, anyway, Obama knew that there was a left wing that wanted single payer, so he came up with the idea of adding a public option to this health care plan. Now, public option is not perfect, but if you're going to take a half-ass measure, probably public option is the half-ass measure that would have been okay. The problem with the public option, it was the sales pitch, because the way it was presented, it would have been like mandate everybody to buy private health insurance. If you can't buy private health insurance, you'll have a you'll have a public institution where you can put yourself in a government pool, a new program to buy relatively cheap health care. The case for it would be that a public option would have been uh, a competitive entity to make uh, private health insurance more competitive. It would drive down the costs. I think that would have happened if we would have had that plan with a public option. It would have been basically something like what the Netherlands and Belgium and Germany have today, and Switzerland. Uh, which what they have basically is a more efficient, generous Obamacare than what exists here. Um, I would have reluctantly go on along with a public option, but because the Republicans and many conservative Democrats said no public option, and the Democrats, even the Democrats who are progressive, caved in under pressure and voted for this shitty health care plan that it's not going to do any good. Now, what a public option approach would have been plausible, I do not know why they didn't do this, was to take the Medicare system as we have it now and say, Medicare, we're going to lower age eligibility to 50. I think that even some relatively conservative people, including moderate Republicans and some conservative Democrats, would have kind of been okay with Medicare being lowered to the age of 50. You'd have had more people involved, and I think that maybe the healthcare plan would have been more broadly supported. But we are stuck with what we're stuck with right now, and I I've actually gotten long-winded enough, so I want to explain basically five five cases, conservative cases for a single payer healthcare system. And single payer, I mean in the form of Medicare for all, like they have in Canada, or the UK style National Health Service, which is actually socialized medicine. And those five cases: labor costs, welfare reform, mobility or of the individual, a disguised capital gains tax cut, and the return of the middle class as a final result. So let's talk about labor costs. Why do we have high labor costs, which causes companies to leave our shores and go where there's cheaper labor? It ain't those pesky unions. It's not even so much regulatory measures. It's inflation due to both private health insurance companies. Actually, three things: private health insurance companies, big pharma, and out of control trial lawyers. You can cut the costs of labor costs of healthcare and overall by getting rid of the private health insurance companies. Just just find a way to phase them out, shut them down now. Shut down private health insurance. It sounds radical, but it's absolutely the most reasonable thing our society can do. Remove and shut down private health insurance companies. Enact tort reform um, to size up these out of control trial lawyers. And right now with the COVID crisis, we could say uh, stop all these drugs being manufactured in places like China. Just put a stop to that right now. Um, you can provide jobs here by basically making it a national security issue to return all pharmaceutical manufacturing back in the United States and allow the U.S. government to negotiate for lower prescription drug prices. And why we don't allow that is beyond me. Uh, and of course, you know, for all the people say, "Oh, big government, healthcare, big government." These are the same people that that wants to make it illegal for you to drive over to the Canadian border to buy prescription drugs, which were patent and okay here in the United States, transported into Canada. So that's supposed to be against the law, but healthcare is too overreaching to make it for everybody. That's crazy. So allow do prescription drug reforms and make it so that it's dirt cheap the way it is in the UK. Even people who are critical of the National Health Service in the UK have no complaints about the prescription drugs. They're cheap as hell in the UK. You can go to your local chemist for about 10, 15 pounds and buy pretty much any drug you need to survive. And why we don't do that here is beyond me. So eliminate insurance companies and all of that, trial lawyers, pharmaceuticals. Let's see. If you are lucky enough to be in a labor union, union people can negotiate and not worry about medical coverage because that's usually what companies will use as a bargaining chip to squeeze concessions out of the unions. If you have a single payer healthcare system, the unions and the company would not have to negotiate over health coverage anymore. So it'll be far cheaper to give people a bump in their pay raise. It'll, or more vacation time, generous pensions. It's a win-win. Win-win for the companies. It's a win-win for the unions, and it will cost less for everybody, and everybody will get more out of this. Um, so that will be another reason for single payer. And look at it this way: it will be a way for the manufacturing base to come back because labor costs tied in with healthcare. So look at it this way: It, it costs more to open up a factory in the United States of America than it does even a country like France, which has a universal healthcare system and a very wonderful, generous welfare state. And yet, it costs less to pay people who are paid more in France than it would be to have a healthcare so to have a factory here in the United States with no union representation for workers, and still it costs more to have. So basically, what you will end up having is you'll have a capitalism which provides a non-exploitive means of economic growth, and that's a good reason. That's reason number one. Reason number two, it'll be formal welfare reform. Let me explain. Medicaid, as exists right now, is basically public health care for the poor, the really, really impoverished people who are down their luck. And you got to make over, you got to be in such an economic tier to receive that. And you have a choice between getting Medicaid coverage in many cases and working versus not working. If healthcare is available to everybody, you might have actually less people on public assistance. So it's a form of welfare reform, um, and it'd be welfare reform that could lap on over into the whole economy. And as I said, to me, it would be a win-win right there. Mobility. A lot of us are stuck at jobs that we hate because we fear the worst. What happened when you lose your medical coverage? Um, Not that I'm crazy about him, but former Congressman Barney Frank of Massachusetts did make a case for single payer years ago in Congress, saying that if you're fired or you're laid off in any country in Europe, you don't lose your health care. But if you're fired or you're laid off here in the United States and you have health care at your job, you no longer have health care. So if you're in a job you do not like, or you get laid off, or you get fired, you want to change, and it'll allow you more upward mobility to have healthcare available to everybody. It'll allow people upward mobility. It'll actually, the whole concept of American individualism would be more enhanced. The current system does not provide that enhanced individualism. And I know, being a socialist, everybody, supporters and naysayers accuse of a socialist being all about the collective. But in some cases, some way or ways, if you're if you're a true social democrat, true socialist, you do support the concept of individualism, and single payer actually provide that. Um, it would also be a disguised capital gains tax cut, and that's tied in with labor costs. So basically, if basically if you have single payer, they're going to be paying considerably less for their health coverage, and the capital gains tax that they pay, even if they pay a little higher for it, will not be as much as what they're paying right now when you combine that with healthcare costs. So the current level of the capital corporate gains tax right now to the government would be a pittance if these companies do not have to worry about healthcare costs anymore. It will all, and number five reason, for those they're concerned about family values and traditionalism and the whole idea of 1950s style Americana, it will be a return of the middle class. The whole, or for the previous four reasons all combined, you will see the return of Leave It to Beaver, of Father Knows Best, Hazel, you name it, from the 50s, early 60s. That whole idea of a majoritarian middle class society, the good society that resulted from Roosevelt reforms in the 1930s and 40s, that resulted into the prosperous society we were during the Eisenhower years, and even during the John F. Kennedy and early Lyndon Johnson years. That middle class Americana will come back if we have universal single payer system. And as I said, I am a social democrat, a socialist. But if I were to turn right wing tomorrow, which I don't think that's going to happen, but if I were to turn right wing tomorrow, I think maybe one of the issues that I would not change my position on is healthcare. Um, look at Great Britain. Margaret Thatcher, with all her faults, the one thing she did not do, to her credit, was to get rid of the National Health Service. Um, the various conservative governments that get elected in these European countries occasionally, they do not get rid of their healthcare system. The Tories in Canada do not get rid of their healthcare system. Um, even the worst prime minister in Israel's history, Benjamin Netanyahu, his government did not get rid of their universal healthcare system. Um, Japan don't get rid of their healthcare system. Australia, New Zealand, um, any advanced a capitalist economy in the world, they do not get rid of their healthcare system. They keep it because they know what would happen to their societies if they follow the failed American model on healthcare. They know what our nightmare is, and they don't want that shit. It's hell in America for healthcare. The average American, unless they have very good health on an individual basis, even someone like me who's on high blood pressure medicine, uh, having to worry about medical costs, because I'm not getting any younger. So the older I get, I'm going to get more problems. It's a fact of life. And so healthcare needs to be available, and it needs to be something where people won't have to worry. All you think you have to do, you have to just hand in your card, and the taxes you may be paying may be a little bit higher, but you'll be paying a little higher, but you'll be paying significantly lower because you won't have private health insurance premiums to pay out of your hind part, your backside anymore. Um, so it makes all the sense in the world to have such a system. And I also need to emphasize, even if you can afford healthcare in the United States, it's bureaucratic as hell. You don't have the bureaucracy in Canada or the UK or Germany or Sweden or any place like that because that's all tied in with keep cost control for healthcare. I ranted long enough, and my name is Bernie Bro. If you like what you heard, please feel free to comment and subscribe to this channel and tell everybody you know about this channel. Let's make it as popular as it can be. Not popular because we're trendy, but popular because we are correct. We're right. We are on the side of justice and compassion, and on the side of good. I'm Bernie Bro. Peace.